So Sam, are you excited for your hair restoration?
I'm very excited. It's been a few years now that my hair's been thinning out, and Ben's been treating me with PRP, and the results are actually pretty impressive. But this is something that I want to do for long term, as almost a preventative, as I see the front of my hairline receding and starting to lose some of the hair right here up on the top of my head. So came over here. Fabien's been amazing. I've known Ben for years, and he's the best at what he does, quite frankly. So definitely trusted my head and hair with him.
I was going to ask you why'd you come to Dr. Ben Talei and not someone else, but you just answered the question.
He's an amazing guy. He knows what he's doing in all aspects of life, and especially in this industry of plastic surgery. So
very cool. We'll bring you to the procedure room now and get you started. You can follow all the procedure in this video. Drawing the patient's blood to get PRP out of it. We're getting 120 cc's. How do you feel, Sammy?
By the way, I told you I was nervous. It was not a big deal. It was 1 minute of, I would say on a pain scale of 1 to 10, maybe a 3 most of the time, 4 at some points, but
so the numbing was okay?
Yeah, tattoo removal is like 6 times worse than this. Hair removal is worse than this, so.
Happy to know. So you hear that? If you want to go ahead and do hair restoration, the numbing is really not a big deal, and then after that, just cruise control. But the hair patient, Sammy, that gave his testimony earlier, we just drew 120 cc's of blood that we're going to spin down and get some super concentrated PRP. So the difference between our PRP system and most PRP systems is that it actually gives you super concentrated PRP. We spin the first vial at 1.5 minutes, 3800 RPM, and then we extract the poor platelet plasma, and we spin it again at 5 minutes at 300 RPM, giving us a super concentrated PRP that's obviously more potent and that's actually more real. For a spin, we get the platelet poor plasma. We're going to extract that, put it in the other tube, spin it again at 5 minutes, 300 RPM, and out of this, we're going to get some super concentrated PRP. And spin from the platelet poor plasma, we spun it down at 5 minutes at 300 RPM. At the bottom, you get the super concentrated PRP, which is approximately 7 cc's. The top is platelet poor plasma that we're going to use with the A cell. From the 120 cc's of blood, we got 14 cc's of platelet rich plasma, and we got approximately 25 of platelet poor plasma. We're going to use the A cell, which is an animal derivative, and it has scaffolding protein that helps with the growth factor. It's very close to stem cell properties. We're going to use this and mix it with 15 cc's of PRP. So basically, we're mixing it and reconstructing it. This we'll use to re-inject into the patient's scalp. The remaining PPP we're going to use to basically soak the follicles in before the implantation phase. And the 14 cc's of PRP we're actually going to inject directly into the patient's scalp to cover the entirety of the scalp in order to target all the existing follicles. The PRP, the idea behind it is that it gives the follicles a second youth, so it makes them regrow stronger and faster. Extracting phase, extracting the follicles from the donor area, which is always the back and the side of the head. The reason being is that the follicles in that area are not affected by the testosterone. Therefore, once you re-implant them into the top of the head, they don't move, they stay where they are. So it's very straightforward. The machine comes in, basically, see it as a high suction machine, extracts the grafts, and then it's harvested. In the extracted grafts, we're separating the ones by group, 1, 2, and 3, and then we're going to use the platelet poor plasma that we spoke about earlier to let them soak. It gives them a better foundation and a better survival rate. So there it is. We're soaking those little follicles with the platelet poor plasma. So Sammy, we're just done with the extraction phase. Can you tell us how you felt? Give us your feedback on it.
I was actually really nervous because I'm not good with needles. It was about 2 minutes of taking small pinches, and after that I didn't feel a thing. I probably slept through half of it, just kind of
mellowing out, listening to my iPhone music, and it was a very pleasant experience. The girls are taking good care of me. They got a lot of good experience, and looking forward to the rest of this procedure and getting some good results.
All right, we're going to go into doing some PRP right now. After that, we'll break for lunch, and then we'll go into the implantation phase.
Right now we're in the middle of our hair transplant. This is a FUE, follicular unit extraction hair transplant. So we've taken away the grafts from here with little tiny needles, just tiny little needle pokes, taking out follicular units. We've set them aside over there, and they're soaking right now in platelet poor plasma. Here I have the platelet rich plasma, and we're going to inject the scalp before doing the hair transplant. So we're going to micro needle into the scalp, and this, along with the PPP, helps increase survival of the donors, of the grafts that we've been putting in there. And it's also going to help nourish or stimulate growth of the native hair follicles. So these hairs that are there right now, instead of just transplanting around them and waiting for them to go away, we're actually stimulating them to grow as well. So you're doing two things in this hair transplant. One is you're bringing density from the side of the head up top, and the other one is that you're increasing the density of the pre-existing or already existing hair follicles up top by doing PRP. So the evidence for it, we're still studying and seeing if we can prove how it works. But if you look at the results from the trusted surgeons in the country who do this, they'll tell you that if you do it properly, which is with very, very highly concentrated PRP, and also using either emulsified fat or A-cell or both, you tend to get a nice result. And the least we've seen so far is that people have less hair loss in the shower. So this is a great option for people who don't want to take Propecia and aren't using Rogaine, and they want something else to stimulate. This is the one thing that we know does help in almost everybody. Some people even have hair growth from it. We just don't know what the percentage is yet. It's about 50% from what we see.
Let's go check on our patient who's having lunch on our patio. Not too bad, huh? In between this procedure, left and right, having lunch in the patio, in the heart of Beverly Hills, Golden Triangle. We're not going through the implantation phase. We prepped the sites, and as you can see, we're pushing in those little follicles into the holes, reconstructing the hairline, reinforcing the hairline, and marching everything backwards. How do you feel, Sammy?
I feel like nothing's happening really.
Just relaxing?
Super relaxed.
It's like a all-inclusive resort? Pretty much, huh?
All inclusive.
We're in the final phases of implanting the last grafts. Sammy's happy. He's gonna go home soon. Everybody's happy. So we're finally over with the procedure. Sammy is looking good, actually. How do you feel, Sammy? Tell us your impressions.
I feel really good. It was a long day, but very pleasant. I would suggest bringing some Netflix or Hulu. The ladies that did my grafts were amazing. FABIEN was great, very helpful here at this office. And I actually feel really good. I'm headed back to Vegas tonight. I'm gonna shoot some dice with this horrible haircut.
Oh, that's a good haircut. All right, would you recommend for people who are experiencing hair loss to undergo this procedure? Like, how did you feel during the procedure? Can you tell us a bit more about it?
Yeah, the procedure was really easy. The first 2 minutes, you feel a couple pinches, and then after that, you're kind of in la-la land. Don't feel anything. I think I fell asleep a few times, so if you're trying to catch up on sleep, it's a good time to do it. But all in all, I've seen some of the results. They're very, very impressive, and I look forward to seeing mine.
All right, thanks, Sammy.